epidemiologically linked, bringing our total number of people diagnosed with COVID-19 to 64,828 in British Columbia. Of the new cases, 314 people were in the Vancouver Coastal Health Region, 618 people were in the Fraser Health Region, 73 people were in Vancouver Island Health, 234 people were in the Interior Health Region, 104 people were in the Northern Health Region, and one person was a case who normally resides outside of Canada. We now have 4,392 active cases across the province, of whom 328 are in hospital, 68 of whom are in critical care or ICU. We have over 6,607 people under public health monitoring because of exposures to COVID-19, and 57,831 people are considered recovered. Again this weekend, we have had new deaths from COVID-19. 26 people have died this past weekend. Our seniors, our elders, our family members, our community members, and our hearts and thoughts go out to all
今天有点晚，他们开了，突然之间就开了。
people
各位观众来不及打招呼，我就记数字了。
This is a very challenging time, continuing to be a challenging time to lose somebody,
他说现在还
especially
是
from
特别困
COVID-19,
难的
and our
时候。
thoughts are with you. We've had one additional healthcare outbreak
又有一
at the
个
Nanaimo
新
Regional
增的
General
这个社
Hospital,
区爆发。
one ward at that hospital. And on a very positive note, we now have 11 outbreaks that have been
那么
declared over.
但是呢，有一个正
At
面的
the
消息，
Avalon
就是
Gardens,
11个已经
the
宣布
Braddon Private
官方
Hospital,
结束
the
了，官方
Fraserview
宣布正式结
Intermediate
束。
Care Lodge, the Good Samaritan Delta View Care Lodge, the Menno Home, one of the larger of our outbreaks, Peace Arch Hospital Foundation Lodge, Sunrise of Vancouver, the Harrison at Elam Village, Waterford Retirement Residence, Williams Lake Seniors Village, and the UHNBC Rehab Unit outbreak have all now been declared over. And this brings a moment of happiness to us all and relief for many of the care providers and the families with loved ones in these facilities. And I think it is a reflection as well of how important the immunization program that we've had in
他也
long-term
说
care
到
over
了，现
these
在从
last
这
few
一点没
weeks
看出
and
来，
the
上个礼
difference that
拜
it's going to make
这
and
个
continues
疫
to
苗
make.
打了之后的显
We
著
now
的效
have
果已经出来了。
29 active outbreaks in long-term care and assisted living, and
那
9
么现在
acute
只有
care
29
units.
个在爆发当
These
中。
involve
这个他也说到，
1,009
不一定
residents
是上个礼
and
拜，也就是说接种疫
579
苗以后产生了这个
Currently, we
相
have
当
one
显
new
著的
outbreak in the community at the
效果。
Surrey Emergency
那么
Response Center
现在在树里的急诊应急中心
the
还有一
Fraser
个
Health Region.
爆发。
On Friday, along with Premier Horgan, Minister Dix,
那么
and
礼拜
Dr.
五呢，我们
Ballon,
3
we
个
shared
还
the
有省长
details of our
给大家
province-wide
详细汇报了
COVID-19
我们丙西
immunization
省的疫
plan
苗计划。
and our age-based approach
这个
that
都
will
是按照
follow on
年
from
龄
the
来
phase
分
1
布，
that we
我
are
们
in
制定政策
currently.
都是按照年龄来施打
Everyone in
优先次
BC
序
is。
每一
important,
个
and
省民
everyone
对我们来讲
who
都
is
是重要的，
eligible
每一个
will
生命
have
都是重要
access
的
to the，
每一个
vaccine
人都会
as
有
soon
获得
as we
疫苗
have
的机
vaccine
会。
available.
那么只要我们疫苗一
What
旦
we
获得，
know
我们
is
会
that
给
no
大家
matter where
及
you
时
work
打。
or what you do,
我们
age is
不
the
管你们
predominant
做
risk
什么工
factor
作，主
for
要是
having
考虑
severe
年龄，
illness
年龄是
or
最重
dying
要
from
的，因为
COVID-19.
年纪越大，
And the
死亡
approach
率越
that we
高。
are taking ensures that those who are at highest risk
所
of
以大家也
illness
知
and
道，就
death
是这个
receive
年
the
龄越大，风
vaccines
险越
first.
大，所以我们要给他们这部分人
This
先打
weekend,
先打疫
unfortunately, we
苗。
received additional information about holdups to the
那么很不
to
幸，
the
这个
supply
周
of
末
the
我们
Pfizer
还是
vaccine that
知
we were
道，就
expecting
是
to
辉
receive in
瑞
the next
没有
few
给我
weeks.
们接下来一个礼
This
拜
next 2
供
weeks,
供
we're
货
going
有
to
点
have
中断。
very little
那么，
vaccine.
所以下个
As
礼
we
拜
knew,
到
we
下个
are
礼拜呢，
receiving
我
no
们的
Pfizer
施打
vaccine
会
this
很
week,
少很少。
and it is also
那
a
么
week
只
where
有
we do not
莫德纳一
receive
点。
any new vaccines
我们
from
接下来就没
Moderna.
有新的
We
疫
have
苗
to
来，
manage our
所
supply
以我们要
within the
不断
limited
的在
amounts that we have.
在供货
And
方
on this
面
weekend,
去
we found
不
out as
停的
well
去 去
去
积极争取。所以我们也期望，那么2月1号这个第一个礼拜会有新的供货来疫苗。那么目前我们现在不知道到底会收到多少，接下来2月份会有多少货会到达。那么目前现在联邦政府都在利用一切力量资源去全球采购这个疫苗。那么目前为止，我们那么到我们省分配到我们省的话，所以可能根据这个第一阶段，我们可能还会调整目标，因为现在因为供货量太有，接下来2礼拜太有限了，我们所以我们现在这个还是要延长，从35天到第72天，短期的，就是第一针和第二针本来35天，现在42天了。那么这个也主要是牵涉到对这个长期护理院以及这个急诊性诊疗所等等，我们也知道他们是特别易受到病毒的攻击感染，但是呢。这个上次说过了啊，这个第一针打了之后2个礼拜之后特别有效了，那么无非第二针打下去呢就是时间长一点，所以42天还是接受的。我个人是因为 I buy her what she said。他说的什么我都相信，所以我把他的话理论我转述给大家。他说我们会越快给大家，每一个人都会打到第二剂只要我们获得疫苗，我们都会给大家打第二针的疫苗。那么过去一周
delivered 119,850 doses of vaccine.That's 87,788 doses of the Pfizer vaccine and 32,062 doses.
所以他说，在过去的一个礼拜里边，我们一共获得了119000多个疫苗，我们都收到了，到上周为止，那么都给各个机器师打了。那么已经有3万多个人已经打了第二剂了，第二针了。那么我们目前为止主要还是对协助性这个护理院以及长期护理院给他们重点是打疫苗，所以我们也很高兴的看到。那么已经有2万多和3万多的这个居民和职员都已经接受了这个，都接种了疫苗。第二针的都是指第二针的。
staff who work in assisted living and 7,147 residents in assisted living. What this tells us is that over 60% of the vaccine that we have to date has gone to protecting those who are the most vulnerable.
所以到目前为止，这个数据表明，我们目前为止接受到疫苗的总量的60%都给了长期护理院的职工和职员居民，说错了，居民啊。所以我也很高兴、很自豪的说，我们在积极的为他们建立防线。
In the Island Health Region, Vancouver Coastal and Fraser Health.
那么这些呢，都包括了沿岸、飞沙以及岛上卫生局下面的这些。
completed by the end of Wednesday of this week. That is an amazing feat.
那么我们接下来在这个本周3之前，内陆卫生局和岛上卫生局都会完成施打第一针的疫苗，这些长期护理院。
But it's also incredibly important with new vaccines, especially
我们也希望有新的疫苗能够来。
that are working incredibly well, that we monitor very carefully for safety.
但是我们也会不积极的观测这个疫苗的安全性。
signals that we've been following in British Columbia.
我们也在观察打了疫苗之后的这些我们也看到了这个副作用以及这个疫苗打了之后的过敏反应等等。
For monitoring these, and the reports come into the BC CDC.
所以所有的报告都会汇报到我们的 BC CDC
reports and looks at their association.
我们都会积极看每一个报告有这个副作用或者是过敏反应等等。
People who are elderly who have underlying health conditions, that there are other things that will happen when
我
we're
们已
doing
经积分析
immunization
到底是
programs
年
in
龄
large
还有
numbers
这
of
个其
people.
他的
So
医
it's very
疗
important for us
个
to
人
know
的身体
exactly
状
what
况
vaccine
等等
people got
才
when
导致了
down
这
to
个
the
疫苗
lot
的
number.
副作用以及
So
过
far
敏
in
反应。
BC,
那么目前为止
we've
我们
had
BC
56 reports of
有
adverse events
56
following
例
immunization.
56例有这个副作用
Close to
或者是过敏反应
120,000 doses of vaccine that's been
56
given.
例很少了，
We've had
我
10
认为
reports of
10万例里边
anaphylaxis
才
or
56例。
serious reaction to the vaccine. That's about 8 per 100,000. That is slightly more than
所
we
以
would
他说
expect
每
based on other immunization
每10
programs
万才
such as
8
for
例
influenza,
左
for
右的这
example.
个真正
We
的
had
数
one
字啊
hospitalization.
我这个不准，他说
Out of those
56例
10,
是
people
10万
who
多
had
例，那么他
anaphylaxis,
说了这个
but all
10
had
万分之
recovered.
8。
In
那
addition,
么
we've had
基本上都已
16
经
other
都
allergic
恢复了
reactions that。were
那么其他的
associated with the
16例
vaccine,
这个
and
过敏
one
等等
case of what we call Bell's palsy or
这个是
paralysis
包
of part
括
of the face.
皮
That's
上
something
疱
that
疹
we've
等
seen
等脸上的
recorded
这
in
种
the
疱疹
trials for
等
this
等
vaccine as well.
这些都是很正常，和其他的疫苗打了过敏反应也是，所以我们也是在积极的观测和跟踪。那么目前为止还没有与疫苗有关的死亡的这个案例。所以，但是我们都会在积极的观测各种各样的症状和信号。
As you know, to children with COVID-19 symptoms, and we have a surveillance system for multi-system inflammatory syndrome.
那么我们 BC 省呢有一套完整的监测系统，对儿童各种各样的这个疾病以及
with MISC, so that is children who have had the symptoms that are associated with this inflammatory condition and have had a positive laboratory test or exposure to
那么我们也是监测到通过全省的联网，只有6例儿童这个是男孩和女孩，都是1岁到15岁之间，上个礼拜都已经全部痊愈了。
In addition, we monitor all people who might have symptoms that could be associated with MISC.
那么我们也在积极的在跟踪观测这些有类似的症状包括了孩子们那些有这个领木症状的这种病症的这个从0岁到17岁之间的孩子们他们特别容易生这种病我们也在观测我们也都去调查，没有发觉有新冠阳性的案例。都没有跟新冠有关。
Weekly on a number of issues that we see, these both around immunization and also around the surveillance that we're doing for variants or
那么现在给大家汇报一下这个病毒的变异的情况包括全世界各加拿大大家都在关心这个问题。我们从这个疫情开始，我们都在做基因测序工作，来看这个病毒是哪里来的。
There are now a number of variants circulating worldwide that are proving to transmit more easily.
那么现在看来呢，现在这病毒的变种在全球来看都越来越容易传播。大家都可以标称这英国变异。
B117
这个技术上是说 B1117。那么我们现在全省有5例。
variant detected here in British Columbia.
B117在全省有5例，英国
related to travel,
全部跟旅行相关有关，
related to
或者是跟亲密接触的旅行者有关。包括一开始3例，后来传了2例。那么目前为止，我们目前为止还没看到，只看到5例英国的变异病毒在我们省。
In addition, we've also had 3 cases arise through our surveillance of the B1351 variant, and this is the one that has been linked with increased transmissibility in South Africa.
这个是南非变异病毒。
Were community acquired.
都是在社区里边获得了跟旅行没关系的，所以我们这个才是真正要关心的。他们是相互联系起来的，就这3例是联系，他们3个里没有联系起来，所以我们在这个延安卫生局都在积极的在溯源往回跟踪看他们是跟谁联系过 我接触过这个当然是我们赢得关注的这因为他们的传播速度太快那么这样的话呢，使得社区会传播越来越快越多，所以我们也是积极跟踪这个那个基因检测来看这个病毒目前的这些样本去查这个基因变异的情况，所以从目前来讲，我们现在看到了还没有看到这个积极的这个快速的传播。
So far, we have not seen widespread
目前为止，我们还没看到广泛的传播但是我们还是密切的关注，因为我们还是很担心这个问题。所以，请大家一定要记住多一层措施来阻止病毒的传播。所以我今天要讲一些事情最重要的。所以我还是要特别要求大家请大家在过去的这个几个礼拜里边，我们每天都有500例太多了这个呢我们不能这个500就相当于一个阈值了门槛，我们不要再过这个门槛了。不过这个过去的3天是1344例少于500例，那么所以这个呢也保持了就是让我们能够更加的对长期护理院的管理以及保卫他们的安全特别是对那些高风险、高危险的地方的环境、密闭环境我们一定要引起足够的重视。我们大家记得去年的10月和11月数字开始每天上升很快我们一定要清楚，我们一定要现在行动起来积极的行动起来，阻止病毒的传播我们现在还有很多人在病重当中还有很多的年轻人已经病重很严重都在有些在医院里已经死亡了。所以这个我们这个会影响更多的家庭、更多的社区以及我们重症监护的资源被击垮所以我们一定要紧张起来神经紧绷所以我们任何事情都做慢一点我们现在是在第2波从冬天过来之后，我们已经第2波了我所以希望大家帮帮我我们一起度过困难我们再过2个礼拜，我们会希望能够把这个曲线拉平不是这是拉平，是要拉下来所以现在是最关键的时候我们因为疫苗有限我们现在疫苗太有限了，所以我们一定要人群目标我们一定要自我限制所以我们现在立刻行动起来所以我请求大家能够往回走一走，始终记住这个新冠病毒这个是一直在无处不在，在我们的社区里边，在每一个角落。所以我也请求大家尽可能的做自己能够和过去不一样能够待在家里待就待家里保持社交距离能够就在家里边去做关注我们的工作关注这个学校孩子关注能够确保我们的公卫的系统能够正常运转这个是很困难对大家来讲挑战太大但是对这个就算我们现在很沮丧很累很疲倦但是我们一定要坚持我们现在已经马上接近了隧道的终点我们马上要请大家行动起来所以我们每天自己也要找一些快乐的事情享受每一天我们已经做了1年了我们已经这样已经1年了我们能够相互支持我们知道我们 每天如果出去每天要出去一下，呼吸新鲜空气我们也可以听听音乐，我们可以看看或者是他说这个 theater 到电影院去看，这个不对吧
？Take care of our
online 我听错了就是在网上看看电影我们就算是要相互拥抱，也是用种虚拟的家庭的团聚，也用虚拟的方式。我们现在呢，只能依靠疫苗了，但是疫苗不能全部依靠它，我们每一个人都要去共同的努力去这个抵制这个疫苗对病情对我们的冲击。我们不能再回到过去的这种社交的无拘的状态了。所以过去在接下来2个礼拜，我请求大家往回走一走。待在家里远离人群就算我们享受这个过程，把这个曲线拉下来请大家分享我们这个信息，这个是所以现在我们正好是时候，我们也是希望大家的帮助我们全省的话，我们都能够达到目标从今天明天都会不一样。我们希望大家从现在行动起来同时也记住be calm, be kind, be safe 安心舒心以及对容忍客气，同时呢请大家安全。那么卫生厅长呢也做一些总结，因为今天的这个电视直播呢有点晚都已经只开始了，他突然还没有，然后突然就说了，所以这个3天的数字分布的情况我没有看到，我可以查一查。那么3天的总数呢是1344，那么他也是说到了现在有过去3天是死了26例所以也要对这个逝去亲人的家庭表示诚挚的哀悼我们的心也一直跟你在一起。
In many cases, worked hard to try and help people get better and to support them in their
527是周六到周五到周六，472是周日到周六到周日，346是周日到周一，所以这个3天是1344，527加上这个472。
Overall, we're still doing in terms of acute care capacity across the board in British Columbia. We're doing fine. Our current level of occupancy in acute care, which is normally at or around 100%, is at 88.7% right now of base beds and 72% of base plus the surge beds that have been added during the pandemic. That our occupancy level in critical care is at 72.2% or 49.1% of all beds when you add, again, the surge beds.
那么他也是汇报了，给大家汇报了这个医院的病床占有率所以我一直在给大家查这个3天的分布是527周六周五到周六，然后周六到周日是472，周日到周一是346，但今天346不一定准，因为这个还是跟时间有关系那么它可能是截止到今天可能是10点11点。那明天可能会数字多一点，我觉得这个也是正常。
There were 49 outbreaks in long-term care, assisted living, and independent living. And
那么他说1月15号10天之前也都有49个，那么今天25号呢才有29个长期护理院的爆发，这个呢也是那个博尼医生刚才也说了，这个明显的就是疫苗在起作用，这个也要给大家说一下，我觉得这些都是振奋人心的。目前为止是本省的这个疫苗所带来的副作用是56例，但是很多是不算。他说真正的副作用是10万分之8，这个也给大家汇报一下。
If you're living in a care home or a resident, if if you're a staff person at a care home or if you're a family member, the day they're declared over, in contrast, can be a very positive day. And for, as we've reported today, in a significant number of care homes, that happened today or has happened in the last 10 days. And this reflects the extraordinary effort being made, and it has been made, to immunize people living in long-term care.
他也是说到了，这个也是反映了这个长期护理院的居民因为60%的疫苗都到了长期护理院给他们打。那么接下来的这个礼拜以及下个礼拜，本省的疫苗几乎就没有了，所以伯尼医生说，这个2个礼拜，请大家格外的再格外就是这个意思。因为目前为止，人类对这个病毒几乎没有办法，最好的办法就是自我隔离，像中国的这样做法。当然，这个在民主国家是做不到的。那么没办法，只能靠疫苗。那么疫苗没有来，那么只能是自我自觉了没有办法强制你，所以这个也是请大家这个格外的引起重视。
Detailed vaccination coverage rates will be made available by February the 8th and be posted at the BC CDC website. I wanted to note with respect to long-term care that in late spring, the Ministry of Health commissioned a progress review of the response efforts made and action taken by the Ministry and health authorities in the first wave to protect residents of long-term care from COVID-19. The Ministry would normally undertake this kind of assessment itself, reaching out to stakeholders, but due to their work on the pandemic, Ernst & Young, a pre-qualified supplier of such services, was asked to assist to conduct the interview, review background material, and put together high-level recommendations on areas for potential improvements suggested by the sector. Through the progress review, Ernst & Young conducted one-on-one or small group interviews with more than 40 stakeholders, including the Ministry of Health, health authorities, the BC CDC, seniors associations, care home operators, providers, frontline staff, and unions. The objective was to seek input from a number of people across the sector about the progress so far in keeping residents of long-term care safe and where and how any improvement in the progress could be made, both in the shorter and longer term. There is also a commitment to share the final report with the sector and take action on the high-level recommendations brought forward. The report arrived in late October for the Ministry's considerations, and the contents of the report were immediately acted upon by the Ministry, and a summary of those actions has been made available along with the report. While other areas identified in the report where progress could be further broadened or expanded or had not been identified internally were also targeted for action. The Ernst & Young Progress Review organized observations and recommendations into 4 focus areas: governance and decision-making, policy, operations, and workforce. Within each area, strengths were identified, as well as opportunities for addressing perceived gaps. Ernst & Young made 14 short-term and 5 long-term recommendations for consideration by the Ministry related to the observations. The background document, as they say, issued with the release of this report, summarizes the observations and provides an overview of related Ministry actions. All of that said, I want to express my appreciation to everyone involved, including Ministry staff. The report should have been released earlier. It was available at the end of October. It was only brought to my attention 10 days ago. I think, I would say this in context. It should have been released earlier. I take responsibility for that. I'm the Minister of Health. I think that the people working in the area, working in our health services branch, are working their guts out, are consumed by helping people in long-term care, as I am, have been working hard on the file. And I think it's because of that they did not proceed to ensure that the report was made public, which is the appropriate thing to do in these circumstances, and also the courteous thing to do when you've asked stakeholders to contribute their opinions to a report, to share the report with them. And for that, I apologize in terms of frustrations people may feel about that. I would just put it in context that I think when you read the report, you'll see that action has been taken on it, And when you read the report, you'll
那么
see
作为卫生
that,
厅长呢，也是对长期护理
overall
院的
and on balance,
那些
the outcomes in British Columbia have been positive or were positive, especially at the time the report
也
was
是做了
done.
一个抱
It's
歉
been
啊，
more
刚才因为
challenging
我
since.
没有
So,
听到他说
just
的是
wanted
哪
to
个
say
报告
that
那么他说有些延迟，那么这
people
些报
should
告
have ensured
呢
that the report
我
was
们所以
released.
把所有
Those
的
same
数据
people have
都
been
给
working their guts
告
out.
诉大
I
家。
ask people to show the same compassion I feel towards people who are giving everything they have to help people across British Columbia. In closing, what we know is that COVID-19 is everywhere in BC. The vaccine is encouraging, of course. It's
他也是
encouraging
说到
long-term
了
care.
这个疫
It's
苗是令人
encouraging
鼓舞的
across the province.
好的消
But we
息和
cannot
效
let
果
it distract us
特
from
别
our
是
duty.
对长期
Let's be
从长期
clear.
来讲。
Everywhere in BC, we must stop the spread. This is a
那么我们也是觉
crucial
得
moment
目
in the
前为止，
pandemic.
只要
These
是
next
能够
weeks
停止
are crucial,
病毒
as
传
Dr.
播的，
Henry
立
has
即
said.
行动起来。
COVID-19
那么
looks for easy
接下
opportunities
来
to
礼拜
spread.
特别关
The
键，
hands
因为疫苗
unwashed,
没有
the
了嘛
mask unworn,
所以我
the
也是
physical
希望
distance
请
ignored,
大家
the
戴口罩
non-essential travel
也是
taken,
保
the
持
risk discounted.
物理距离
It thrives on
包括
public
避
health
免不
orders
必
and
要的旅
guidance
行、非
disobeyed,
必要旅行。
unheeded, and our skills unused. In the weeks and months ahead, we must continue to heed and adapt to our BC pandemic reality. There can be no welcome mat for COVID-19, no porch light on to draw it to our door, no opportunity for it to cross that threshold. We've been taught the skills to stop the spread. We must use them. We must only socialize with the people in our household. We've been given the guidance to keep us safe, and this
所
is
以
the
我们也给
moment
大
to
家了很
follow
多
it.
的行为
And
规
we've been
范
provided
指
with
引
public
指
health
导，
orders
请
that
大
save
家能够
lives. We must uphold
遵守，这些
everywhere
都是
in
拯救
BC.
生命的。
We've been
我们
100%
BC
committed to our
省每一
fight,
个
and
地
our
方
fight
都要
is
这么
far
遵
from
守，
over.
我们一
We
定要
must dig in
打
to
赢这
stay
场战
all
争
in on our
我们
duty
一
to
定
stop
要
the
这
spread
个
in
往
our
前走
homes,
这
in
也
our
是我们的责任
communities,
来
everywhere in BC,
阻止病毒的
for the
传
ones
播
we love
在我们
and
社
for
区
the
里边，
ones
在我们
we
家
don't
庭
know.
里边能
Aujourd'hui,
够
nous
来
faisons le point sur le nombre de
使
nouveaux
使
cas
得我
pour
们
trois
所爱
périodes
的
de
人
référence de
能够
24
安
heures
全
chacune.
那么卫生厅长又做了这个法语的总结。那么我把过去3天的数字给大家汇报一下。周5到周6新增了527，周6到周日是472。周日到周一是346，3天总数是1444。那么本省的总数目前新增的阳性案例是64828，那其中呢，飞沙延安卫生局是314，飞沙卫生局618，岛上卫生局73，内陆卫生局234。那北部卫生局104，这个疑似是1例，住院的是328个人，其中68个在重症监护。那么很不幸呢，有过去3天死亡了，新增死亡26例，那么到了1104。
I would also ask that please take your phones off mute. You are not audible until your name is called. First question today is from Marcella Bernardo, News 1130.
Hi, everyone. I have a lot of questions, but I know I'm limited to 2, so I'm going to start with this report from Ernst & Young that came out in the fall and identified problems that needed to be fixed. And during phase 1, outcomes were better. So can someone please explain what went wrong in November when supposedly changes were being made to ensure that long-term care was going to be better?
那么他这个记者问的尖锐的问题，有一个长期护理院的问题是11月就出来，但是报告才刚出来，这个也可能是为什么刚才卫生厅长给大家道歉。
And it is very challenging for us to know when people are incubating the disease and when they can transmit it to others.
那么他也是说到这个病人在这个潜伏期，病毒在潜伏期的人时候，他也是能传播的。这个在长期护理院，这个特别是这个因素。这个在我们长期护理院也好，全球看好都看到了这个重要的因素。
There are some of the issues that were identified that are not things that are going to be solved within a matter of months or weeks.
那么很多问题呢是找到了，但是呢没有办法一下子解决，在数月里面能够解决。所以这个长期护理院也存在着这个问题。我们看到了这个长期护理院这个这个快速的爆发，这个也 是刚才我这个问题的反应，特别是我们也审视了这么多老年人，所以我们有太多的原因一定要关注这个疫苗对老年人第一个重点给他们施打。
I think that's right. I think one of the things that we've noted and is noted in the report is that British Columbia has, and over the time of the pandemic, done better than other jurisdictions. But if you have a family
那么现在
member
卫生
in
厅
long-term
长
care,
又来
what
说
happens
了，
in
我们
Ontario,
宾溪省
Quebec,
比其他的
Alberta,
省
Manitoba
安省
is of
阿省
little
安
relevance
省
to you.
Manitoba 都比他们好
I think actions have been taken,
长期护理院的
to
情况
make,
都比他们好
significant improvements.
这个
What's
我们也
happened
是
in
有
November
那个
and
长足的
December
改进
and now January in this second wave of COVID-19 is significantly more community transmission, and
那么
that
他说
reflects
从
in
10
long-term
月
care.
10月
In
11月
Vancouver
到
Island,
现
we've
在
had
那么
very
社区
few,
的爆发
I think,
传播会更
less
多
than a
这个第二
handful
波
of people who've passed away in long-term care in all the care homes on Vancouver Island.
那么现在呢
which
过
are
去的
putting
这
in
个
place
周
the
末
same measures,
死
but
亡
there's
的都集中
significantly
在这个
less
岛上
community spread, and that affects healthcare workers less, and there's less outbreaks. So I think this has been true everywhere in the world, and
所以他说这个也是
every effort
其他地
that
方
we
都
can
一样
make in long-term care,
我们全球都一样，都是在保
I
护
know
长期护理院
from, throughout
养老院。
the pandemic, from having talked to families, from having talked to care workers on a regular
我
basis,
们也
what
是
it
跟
means.
家属啊
Because in
跟这个
addition
员
to
工
the
啊
costs,
都是
the
健
people
康
who've lost their
跟
lives and the impact of the outbreak
他们所做的一切
on
都是在拯救
residents,
生
on
命
families and staff.
所以他们也是
We're
很
coming
多
up
人
to
失去
March
了
and
生
a
命，也
year,
失去了亲人。
the first year after restrictions on visitations were
那
put
么
in
我
place in
们这
long-term care,
个
and some of
对
those were
长期护理院
limited
探
or
望的
lessened
限制
on June
也是
28th
快
of
差
last
不
year,
多
but they're still in place,
从
and
大半
so
年了，
the
从6月
consequences
28
for
号
people are
那么然
significant.
后呢
We're
就
aware of
是
that, and that's why those measures on
对
visitation,
他们
the
很多
measures
限
on
制，
single
那么
site,
这
the
个呢
measures
也
on
产生了很多
bringing
的很大的效
PPE,
果。我们因为要
bringing
提供
long-term
很
care
多的
homes, which are
个
generally
人防护
responsible
服
for their
啊，
own
以
PPE
及
under
这
their
个
contracts in the
在
contracted
探访
sector,
点的额外的
into
限制措施
our
卫
supply
生措
chain,
施。
all of the efforts in infection control, the efforts in many care homes that have had outbreaks for health authority officials to go in and lead or help with the leadership of those care homes and the challenges they face. All of those things have occurred, and yet you're absolutely right. There have been significantly more outbreaks and more losses, and we continue to take those actions, and we'll continue to
我
take
们
the
也会
actions.
持
One
续
thing I
的
want
在
to
继续的
emphasize
行动
finally,
我们坚持
everywhere,
会下去，
is
不会
that
停止下
while
来。
immunization is an important
那
answer,
当然了，疫
people
苗
have to
是最重
continue
要
to
的
dig in in the
但是我
healthcare
们也
sector,
是希望每一
in
个
every
人
other
坚持下
sector,
去
and。in the community, that even when one is immunized,
就
one
算
has
是
to continue
你
to
已经
use PPE
有
and to
疫苗
use
了，但是还
protections
是
and to
请你
support
使
social
用
distancing.
这个
This
个
is
人
a
防护
time,
服
January,
也是要
when
坚
there
持
is
社交距
spread
离
of
因为现在这
COVID-19
个时间
everywhere
是
in the
正好
world
是
and here in British
关键
Columbia,
的时候
with the
这
cases
个
that
全
we
球都
announced
一样，
today,
我们希望
almost 500 a
你
day,
看大家
just
看到了
slightly
每天新增
below.
都差不多
And
500
we have to
或者
continue
500
to
以下
take
一点
steps to
点，
reduce
那
that
么希望
transmission
大
in
家
order
能够
that
持
those
续的
most vulnerable
坚
are
持下
kept safe.
去能够减少每天的
Do you
新
have a
增
follow-up,
案例。
Marcella?
I do. It's regarding the rollout of the vaccine from last week. I know when initially we started receiving doses from Pfizer and Moderna, Dr. Henry expressed concern about the safety of those stocks. And with the rollout now moving to 172 communities, what efforts are going to be made to ensure that we don't have terrorist attacks or sabotage of that much needed vaccine?
Yeah, that's
那么他也
one
说到
of the
了
things that
国
we've
际医
been
生
thinking
也始终
about,
强
and
调
it is
关
one
注
of the things
这
that
个
we've been
供货
working
量的问
closely
题。
with
那
the
么现
NOC,
在
the
可已经没
National
有了。那么看
Operations
看
Center,
我们的疫苗
and
是不是
we
会
do
遭到
have
破坏和
federal
浪费的现
agencies that are
象。
involved in helping assess the risk as it goes. We
他说
also
我们也有
have
联邦的
procedures
这
in
个
place
秘密
around
工作
how
人员也是
the
在这
vaccine
个
is
参与进来保护疫苗的安
transported
全。
and safety measures,
包括
and
他们
as
的
we've
运输
had more
以
vaccine
及其他的
available,
卫 安
it's
全措
been
施。
easier and more ability to be more open about where the clinics are. We do have security, of course.
当然了，我们
and
也
we
有
will
这个保安
continue
系
to
统
have that to make
对
sure
这
that
个
people
施
are
打的点
comfortable
都
and
有
safe
这个
in
安
those
全的
clinics.
也让大
So
家
far, we
觉得苏新很安全。那么
response,
目
and we
前
have
为
not
止
had
我们的
any
应对都还
incidents
比较好
that
没
we're aware
有
of,
一些这
but
个
we have been watching that very
额
carefully.
外
I
的
know
因素，没
there
有
was a lot
没有
of
那些事
online
故
chatter. We
当然
understand
我们
from
也是
the security
紧密的观测
services
它包括了这
about
个保安系
disrupting
统
the vaccine
包括了这个
supply
疫苗的
chain
供应链
and undermining confidence in the vaccine for various reasons.
我们
A
现
lot
在
of
大
that
家
came
很
out
多
of
对这
issues
个
in the United States and
这
other
个包
places.
括
So
美国啊
it
和其他的
seems
地
to
方对
have
疫苗的
settled,
一些问
which is a
题
good thing.
但是现
Obviously
在呢
right
都
now
一
our
点点
biggest
都安
concern
排下来了
is
都搞
access
定了
to
那么大家就
vaccines
去
so
放
that we
心
can get
那么
this
现在
program
最
up
大的
and
问
running.
题就是供货
Next
量
question is
那
from
么只要
Victor
供货
Kaiser,
量到
Radio
了
1.
那么我们就会按照我们之前制定的计划继续进行
Good
下去
afternoon, Dr. Henry. Just was trying to hopefully get some more information on the outbreak at Royal Inland Hospital. We've heard concerns after it grew from 8 to 48 cases, the lack of information, lots of rumors and anxiety over the weekend. Heard that health authorities perhaps don't have all of the resources they might need to put out information in a timely manner, whether it's the interior or the lower mainland or elsewhere. So I was hoping whatever you could tell us about the outbreak, but then also these issues of this perceived lack of transparency.
Yeah, I think it is always a challenge about who wants what information, and the focus, the overriding focus, has been on providing the information to those who need it in the facility, the patients and their families, the staff and the staff in the facility. So that has been and will continue to be the overriding issue that people are paying attention to. And yes, the outbreak did grow. We've seen this with many outbreaks, that we tend to have 1 or 2 cases identified, and part of our automatic response to outbreaks, particularly in care homes and in acute care facilities, is doing testing of all of those staff and patients or residents in the affected area. And so we expect, and what we have seen is as we do more testing and we do surveys of all of the people who are potentially exposed, the numbers of people who test positive go up. So it is part of the routine outbreak response. We know that this part of Interior Health has not had a large outbreak in their healthcare facility, but yes, they have been accessing resources from Interior Health, from the Lower Mainland. We have a support process both for public health, for infection control, to support staff in the area as well. So I know the investigation, and very often early on, the numbers are changing very quickly. So that is another factor with it, and the investigation was ongoing since the first cases were detected late last week. It is always trying to satisfy that need for everybody to know exactly what's going on as things are changing very rapidly, and they do change very rapidly, especially early on. So we did have the numbers today. Those will change, and they'll change as this outbreak progresses. And the outbreak control measures are put in place, and Interior Health is continuing the investigation there.
这个是太令人惊讶了，这个数字其实也就是说一开始你这个调查没有深入下去了，一开始8个，当然调查越多就会越这个阳性数据就越多，所以
in December weren't necessarily wearing masks, and I guess these patients perhaps eventually contracted COVID by being in a different ward of the hospital. They allege the masks were really, they allege rather that even they weren't required to wear masks, only had to when being taken to get more tests. So I'm not sure if you're able to kind of address maybe concerns like this, that protocols perhaps may not be following strictly by health officials or even patients.
那么这位记者说的就是很多有些护士没有完全按照这个 protocol 严格的要求去带那么特别是在开路子那么他说很多的医院的爆发的情况
or this was the causative or that was the cause of it. It's always a number of factors. And
他说的确是有很多的因素促成这个社区的爆发。
Outbreak, but those are the things things that we look at. And
我们也是在观测这些事项。我们每天都会跟早上跟大家关照大家我们不能再让这个事情下去，我们一定要戴口罩，哪些是做，哪应该做，哪应该做我们省的这个规范是什么特别是在这个每一个长期护理院包括这个卫生医疗机构。
Impossible to always adhere to everything that we need to do. That's why we have what we call layers of protection or a hierarchy of controls in acute care facilities. And that includes things like having barriers, it includes things like administrative policies that say you have to be screened actively before you come in every day. We know that people get tired with that and sometimes things slip. We know that there's a testing policy. We know that things like we minimize the number of people in the room, we set up the waiting areas so that there aren't people right next to each other, that masks are available, that hand hygiene is available. There are layers of protection in the hierarchy of controls so that we don't only rely on one thing like mask wearing. But these things get stretched, and this virus shows us again and again that even small breaches can lead to transmission when we're not expecting it. And it's often not where we are paying attention when we're providing care to a patient, for example. It may be when we're inadvertently letting things slip, when we're in the lunchroom with the people we work with every day, or when we're in a setting that we think is less risky. So all of those things are the things that we pay attention to once we start detecting cases, once we see how far it's spread, and we need to reinforce those infection control measures. But I think all of us around the province who work in healthcare need to remember that this virus is out there, and we cannot let down our guard, and we need to pay attention to all of these layers of protection, this hierarchy of controls.
Sergeant CTV.
Hi, Dr. Henry. Just to clarify, you said that there were 5 cases of the UK variant. The BC CDC in its situation report said 6. And just wondering if you can clarify that and also let us know, are you looking, is there a plan to step up the whole genome sequencing, or is there something that you're looking for the federal government to do here as well?
那么他说也是关于这个英国病毒变异的病毒的情况，那么能不能联邦和联邦政府部门联合做这个基因检测因为我们的基因检测不多因为这个
It could have been that there was an additional case on the weekend that's not in my list, but we can check on that. All of the UK variant ones were related to travel or contact with somebody who had traveled. And yes, we are stepping up. We've been doing quite a lot. We've been doing more than many other jurisdictions because we have a lab that has a lot of expertise in this area, and we've been doing, I think the whole genome sequencing is something that has helped us from the very beginning.
所以这个从一开始我们就在做这个基因检测了，从一开始就做林德王Natalie Precision 他们都是这些在做他们的领导的团队就在做这个基因检测因为我们这么做的话我们看到这个病毒是哪里来这个我们的社区流传的病毒是哪些我们现在当然了也跟联合国的卫官生物联合起来我们都跟他们有联系我们同时呢我们也对那些有抗体的有免疫的人也做紧密的观察我们包括了医院长期护理院学校等等这些都在继续做我们这些都是有策略性的去这个是都是有这个计划有步骤的去做
It is something that I am very proud of what we've been doing in BC, and we've been leading the way in the whole genome sequencing strategy here in British Columbia, so we will continue to do that.
我们持续的会做也就是从伯尼医生的话来讲我们 BC 省的基因检测这个工作是领先于其他很多国家和地区的
This report from Ernst & Young highlights communication issues contributing to a lack of clarity, confusion, and
又是提到了 Ernst and Young
what
这
are
个
you
长
going to
期
do
护
to
理
fix
院。
that?
Yeah, well, we've already been starting on that. I think we have to remember that the healthcare system, and we're talking about in this report, is complex. And long-term care has many different ways that it is delivered. We have private, we have public, we have health authority owned and operated, we have contracted, for-profit, not-for-profit. The whole history of how long-term care homes developed is complex. And when we put in, for example, the single site order, it was not universally accepted.
举个例子，我们颁布了一个工人只能在一个长期护理院做的命令，那么都是不是统一的，没办法，因为很多的长期护理院或者养老院的结构是不一样的，雇工结构都不一样，所以这个为什么花了很长的时间去解决这个问题？
And we know in the Lower Mainland, for example, where people often worked in facilities,
那么他说就是在长期护理院
Health or Vancouver Coastal
有一个员工一般一个员工都会在不同3-4个长期护理院在做，那么这样子给这个给管理的工作人员都带来很大的挑战啊，他们要不断的甄别在哪里去做所以这从去年4月份到6月份花了30个月才慢慢梳理，能够才使得每一个人员工只能在一个护理院工作。
go out to long-term care homes, to communities, how outbreaks are managed. We're slightly different in every health authority as well. We are trying very hard to come up with consistent provincial approaches. I meet with my colleagues very regularly to try and do that. But there are different ways of doing things in each health authority, and we are coming out with a higher level guidance from the province to try and address that. And we see that in the provincial visitation policy, the essential visitor policy, where we're trying to get consistency. But we have over 530 long-term care homes, and they are all operated by different entities. And
530个长养老院要统一实施这个都是执行起来有难度，因为每个长期护理院都有自己特殊的情况这个困难是很大的，挑战也很大。那么请卫生厅长再做一个补充。
Just to take two of the things that happened, the single site order, which affected directly the employment of 8,500 different healthcare workers,
8500多个全省长期护理院的员工，对他们的打击是冲击是最大的，因为这个以前牵涉到报酬技工的合同等等不一样。
And yes, there were challenges.
因为这个是前所未有的，这个困难对我们来讲太困难了。
application of that order and the
所以这个命令的执行都需要花很长的时间，包括我们的伯尼医生以及他的团队都是在公共系统提供了很大的支持和帮助。
Beyond question that that's the case. They're also better here than other places because of the effort applied to them. Equally, with respect to PPE and its availability and supply chain, that happened sooner here. We took the approach, it was a Team BC approach involving everybody to try and achieve success in these quite complex initiatives that were taking place in the time of pandemic. And I think that the overall results in British Columbia compared to some other places, Ontario and Quebec, Manitoba and other places, which were dealing with similar conditions in the community, were good compared to them, but there are always challenges. I would say this though,
就像我们家长老是跟孩子说，哎，我比谁好，那我们家长就会说，你不要去跟别人比。但我们的卫生厅长就跟这个安省魁省阿省去比我们比他们好多了，大家条件都差不多，情况都差不多，我们的现实的情况就比他们好，等等。也是说到了政策的一贯性，也是如何的坚决贯彻制定的政策。
There have been fewer changes elsewhere. Sometimes the orders have not been as severe as other places, but I think they've been followed more carefully because they've been delivered and held over time. And so what is unique and what is clear everywhere is that we have varied human activity everywhere. But the orders, I think, have been consistent. They haven't moved very much over time. And the current orders, for example, have stayed consistent since they were first put in place by Dr. Henry. And I think that consistency, along with the real contribution of people everywhere in BC, has made a difference here. Can we do better? Always we can do better. But I think the consistency with Dr. Henry has viewed this, and her understanding that every decision has consequences for other things.
所以他也是说到了每一个决定都会导致其他的事情的后果。这也是说到了今天他们做了一个解释，也就是说为什么长期护理院一直在爆发，一直就没有解决这个问题那么又提到了一个员工只能在一个长期护理院工作的这个政策等等。那么今天从这个答记者问里边，我们也听出来，按照保尼医生的说法，就是按照我们卫生厅长的说法，我们 BC 省的长期护理的情况比同类的还好很多等等。
Yeah, well, it's a race between the virus and the vaccine.
那么他也是说到病毒和疫苗总是在竞争。
The virus can cause enough havoc itself without having these mutations that make it more transmissible, apparently
所以他说按照规律来讲，病毒不断的在变异，都会是使得自己更容易传播。所以这个看到了英国的病毒所以这个也是在全球英国的变异病毒这个能够快速地传播。
It's hard to know whether it's because so many more people have been infected that we're seeing more people end up in hospital and more people having more severe illness. So yes, I'm very concerned. I'm concerned that we can that if those variants start to spread, it's just going to make our job that much more difficult.
但是现在已经有了，我们有武力。
If I could somehow magically get vaccine,
如果我自己有生产的话，我也希望像变魔术一样能够让每一个人快速的打上疫苗。但是我们没有这个能力，所以为什么今天我是一再强调希望大家我们一定要理解，我们现在已经很有风险的每天新增500个人的。太多了，所以我们希望马上就会这个500是很危险的一个地方，马上就会像火箭爆发所以我们希望大家能够紧密行动起来，像去年拉丁曲院一定要拉丁曲院，所以我们一定要注意，我们一定要注意自己停止病毒的传播。我们知道如何做这样就不要旅行。
Because we take our risk with us and
我
we
们
bring the
如果旅
risk
行的
back
话，我
from
们其
where
实
we've
把自己
been.
的风险带出去，也把风险带进来。
Not to
我
come
们
to
呼
British
求
Columbia right
人民
now.
不要出省，
To
不要出
interprovincial
省
travel, international travel.
不要跨
That
省，
is something
不
we
要
should
跨
not
国际
be
旅
doing
行
now.
我们现在不要这么
And
去
we
做。
need to recognize for
我
the
们也
next
要
few
认清，
months,
在过去的
travel
接下来的
is
几个
risky.
月，
That is
旅
how
行
these
都
new
是很风险的
rapidly spreading
因为
variants
这
can
个
come
病毒
into
传播会
BC
很快
and can spread.
马上就会传
So
到
those are
BC
the
省
things
来
we need to pay
也在
attention
BC 省
to.
会快速传播所以我们希望
Those
大家
who were
格外
talking
的
to me
注
this
意。
morning would know that this is something that I am very, very concerned
所以
about.
这个我真的是
We do
很
not
担心，
have
很担
enough
心。
vaccine to protect
我们
everybody
现在
who
没有足
needs
够
our
的疫苗
protection
来保
right
护每
now.
一个人。
And we're not going to get that until a few weeks on from now, even to start. So we have to pay attention to
所以我们
these.
不得
The
不
sooner
注
we
意
get our
只
numbers
有我
down,
们
the sooner we can get back
哪一
to
天
those things
数
that
字
we
下来
want in
了，
our
哪一
lives,
天我
getting
们才
our
会恢复
economy
到
going,
正常的工
getting
作，
our
我们的
social
经济才
interactions
会恢
back
复正
together.
常，
But
我
now
们
is
的
a
社交
dangerous
生
time.
活才会正常。但是现在是太危险了，太危险了。
We've spent some time today talking about communication and long-term care, and one of the areas where it seems to have fallen, in some sense, to the wayside is around essential visitors. There seems to be an inconsistent application of that policy. Would you consider mandating long-term care homes in BC to give every resident an essential visitor?
So it is essentially a mandate that the guidelines need to be followed. And my assumption is, and I've made this clear, that everybody is entitled to have an essential visitor. We know that not everybody needs one. We know that not everybody has somebody who can play that role for them. But we need to err on the side of having somebody for every person. But we also know that it's risky, and as I said, there's over 500 different care homes that have different leadership, that have different ways of doing things, so coming to consistency is a challenge. And we are working on that by having very consistent guidelines and putting out those messages to people that this needs to be followed. And also there is a process, and I want people to know that there is a process that they can go through if they feel that they're being unfairly denied an essential visitor status. That involves going to the administrator in the facility. It involves going to the patient care quality office in the health authority where the facility is. It involves going to my office if need be. There's an escalation process, and people can also go to the office of the ombudsperson with their concerns. But we need to make sure that people have a process for being able to get an understanding of the essential visitor status. But it is something that is so hard for people. There's a lot of concern on both sides. Staff are concerned that the more people that come into the facility, the greater the risk. And we know that it's a hard balance to have quality of life for people in long-term care. And that's why our focus right now is on protecting people in care homes as best we can and making sure that those visits can happen.
We have time for one more question for everyone listening today. Dr. Henry and Mr. Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi there. So, Dr. Henry, what is your reaction to the BC couple who went to the Yukon and lied to get vaccinated? And since they are from BC, we're also wondering what that means for them getting their second dose. So, what is the policy for the second dose for anyone who goes out of BC to get a first dose?
I think they should be ashamed of themselves. They put a community at risk for their own benefit, and that to me is appalling. In terms of people who are immunized somewhere else and are in BC, if they're residents of BC, then the second dose may be here in the same way that if we have people who are in British Columbia for their first dose and live in the Yukon or Alberta and get their second dose there. So that is something, the immunization is free for Canadians across
那么对加拿大人来讲，每一个加拿大人都是免费获得疫苗的，所以就算你在其他的省打第一针你到其他的省可能打第二针都一样。因为上个礼拜说过疫苗不同牌子的能不能混，也就是说第一针打的是辉瑞，第二针能不能打这个莫德纳。那么他说从这个mRNA 疫苗来讲都可以的，但是现在还没有这么做。
Do not think that way and know
希望大家不要这么做，像这个那对夫妻一样到那个医空去插队去打这个希望大家不要这么做这个的确是感到羞耻，应该感到羞耻。
Isn't bent back down in BC. Further restrictions could be necessary. So please tell us about what those restrictions could look like, and of course, can we get an answer in French as well?
Yeah. So we have tried very much to only restrict those areas and those places where we know transmission risk is
他说我们这个禁令呢，主要还是对那些特别容易传染的高风险的地区特别加强了这个限制措施包括了餐厅酒吧等等我们限制人数包括了戴口罩包括了这个营业的时间等等等等这些限制措施是还是很严密的。那么我们也知道这个餐厅在我们社会社区所取得的作用包括了零售店零售商也是我们都限制了很多限制措施放了很多的限制措施但是我们也知道这个些限制措施大多数行之有效的所以
meant that we've had to take additional steps. We saw that with nightclubs. We saw that with some sports venues where it was the before and after where people were coming together and socializing and spreading the virus. So we needed to take restrictions in those areas. If we find that people are not are trying to bend the rules to suit their own needs, right now that is going to mean that transmission will continue in our communities and we'll have to look at additional ways to prevent that. So I can't tell you exactly what right now, but we need to all pay attention to the fact that we are in the second incubation period from a time where people
注意防范特别是病毒潜伏期
took license to travel, took license to be with others, and we've seen that has led to transmission. We had a blip and we've now leveled off, but we're still at a very high level. And it is those same things. It's those traveling, it is having social interactions that aren't protected. We can still go out and do things, go outside and do things online, reach out to people, support each other. But now more than ever, we need to pay attention to those environments where we're in close contact with crowds, when we're talking loudly, when we're not wearing masks, when we're not keeping our distance, when we're inside in particular. Those are the risky environments that we all know, and we need now to pay attention to more than ever so we can get through this period.
所以呢，我们希望大家能够现在就积极做起，避免时刻警惕，避免上述的这些。那么现在呢，这个卫生厅长又用法语在回答这刚才记者的提问。那么我再把过去的3天新增的数字报告给大家。周5到周6是527，周6到周日是472，周日到周一是346，3天新增了1344例。那么 BC 省累计64828例，其中沿岸卫生局新增了314例，飞沙卫生局新增了618例，岛上卫生局新增了73例，内陆卫生局新增了234例，北部卫生局新增了104例，疑似案例有1例，目前住院的是328例，那么其中重症监护是68，这个好像绝对数字是下来了，但是中旬的时候10天前住院都是350几，那重症监护是70几，那你现在是住院是320多，重症监护还有68，这个要引起重视。那么在过去的3天里边新增死亡26例，达到了1104例。到上个礼拜为止，因为现在也没有办法更新疫苗的数字了，已经超过了10万9千例打了这个疫苗。那么目前为止呢，60%的疫苗是给了长期护理院。各位观众，他们的直播呢也是到这儿为止。那么今天的新冠疫情就新闻简报就给大家转播到这儿。我们下一期也就是星期四再回来，感谢大家的收看，我们星期四再会。